Good afternoon. My name is Stephen Aquario, and I am the Executive Director of your New York State Association of Counties. We're very pleased to have you join us here today for this very important and timely discussion on the COVID-19 vaccine distribution in the state of New York. We want to welcome our NYSEC members across the state, the county health officials, administrators, county executives, public health commissioners and directors and so forth, and all the other county officials that are with us, and the guests who have joined us for today for the second session of our virtual legislative conference this week. We will have had 10 virtual workshops designed to bring you the latest information on the issues facing today's county leaders, from the State House in Albany to the United States Capitol in Washington, D.C. For nearly a year now, the counties have led the fight against COVID-19 from the front lines. In December of 2020, the approval of 2 vaccines offered a light at the end of the tunnel, but the work for our local health departments was far from over. As vaccine supply increases and more New Yorkers become eligible for inoculation, the counties have been called upon to assist with distributing and administering the vaccine to the millions, the 10 million of eligible individuals who want it. Today, we will hear from the White House and 2 county health officials from our own state about the federal and state efforts to distribute the vaccine and communicate its safety and efficacy to the public. Before we get going, Jeanette Stanziano for a few housekeeping remarks. Jeanette.
Hi, Steve. Just a couple of pointers before we begin. We will be recording this program, and we'll be posting the recording at the NYSEC website with a PDF of any PowerPoint presentations that are featured during this program. To find this recording and PDF, just go to www.nysec.org/education and click on the virtual 2021 legislative conference. We ask you to submit your questions in writing for the Q&A at the end of this program. To do so, just go to your GoToWebinar dashboard and click on the questions tab and type in your questions, and we'll try to get to as many as we can at the end of the program. Stephen?
Thank you very much, Jeanette, and thank you for all you're doing. Quick sponsor message. We'll get underway with our program in just a minute. I want to first thank our sponsor for this session, Zen City. We're very grateful for their support in helping us to inform and educate hundreds of county officials from across the state. Let's do a very short, very brief message from them now.
Thank you so much, and thank you for having us. I personally am super proud to support NYSEC and the important work of counties in New York and around the country. We at Zen City, as a company, serve only the local government sector, and today I'm proud to say we partner with over 200 counties and cities across the country, including Riverside County, California, and Sarasota County in Florida. Our main goal is to help leaders like you make better decisions by really understanding the needs and priorities of the communities that you serve. We know that you spend your days serving your communities in the best way possible, but one of the challenges is really understanding and prioritizing what does my community need the most. We hear a lot from our county admins that the tools that they have on hand today are limited to mostly hearing the voice of what some call the STPs, the same 10 people that always show up to every engagement opportunity. And our goal is to look beyond that and let you hear the real voice of the community that you serve. We do that by aggregating data from a lot of different sources, like social media, Facebook and Twitter, like your own customer service data, like 211, 311, or emails that you're getting, and from online media. And we loop in all of that data, and with some advanced AI, advanced machine learning, we turn that into structured numbers and scores that really show you what's going on and what is the lay of the land in terms of your community's priorities. Using that, we help cities and counties through issues like public safety, COVID-19, of course, and even transportation planning. So I think vaccination is probably the biggest challenge that we as a nation are facing, and a lot of that responsibility rolls to the door of all of you, of the incredible counties of our state and country. And one of the most overlooked challenges in running a smooth vaccine operation is increasing the trust of your community in the vaccination operation. We see from our data today that there is an incredibly high level of misinformation and of negative sentiment around the vaccine. We see from the counties we partner with that to run a smooth vaccine operation, we really need to take control of the narrative and work strategically with our community to get them on board with getting the vaccination. Because if the majority of the population don't show up, the vaccines just won't work. So we help our partners really identify what is the sentiment of their community towards the vaccines. Are they positive or negative? What misinformation might be impacting their opinion? And how could we really make a change in their perspectives so that they be positive and eager to get the vaccines as fast as possible and to run a smooth vaccine operation? We are proud to partner with counties across the country, and we honestly just opened our first New York office, and we are really eager to partner and support the incredible work that counties across New York are doing. So if there's any way we can help you with the vaccines or with any other issue that's top of mind, we'll be proud to help you really listen to the voice of the majority of the community that you serve and help you with your super important work. Thank you so much for having us today, and have a great rest of the event.
Terrific. Thank you very much to our sponsors, Zen City. Very pleased to have their support. And now we're very happy to be joined by 4 speakers who are leading the COVID-19 response and recovery efforts across the country and at both ends of our great state of New York. First, we're fortunate to be joined by the White House's Intergovernmental Affairs Director for COVID-19, Eduardo Cisneros. Before joining the White House, Mr. Cisneros was the Director of Civic Engagement at UltiMed Health Services, one of the largest not-for-profit federally qualified health centers. We're very familiar with FQHCs in the United States. Mr. Cisneros is joined by Mr. Luke McGowan, a senior advisor in the White House Office of Intergovernmental Affairs. Before coming to the White House, Mr. McGowan previously served as the director of Burlington, Vermont's Community and Economic Development Office. Very pleased with the White House engagement on this important call. We're also joined by the great Nassau County Commissioner of Health, Dr. Larry Eisenstein. Dr. Eisenstein is a board certified in infectious diseases and oversees the health of Nassau County's 1.35 million residents. And finally, very happy to have the Allegheny County Public Health Director, Tyler Shaw. Mr. Shaw has been with Allegheny County Department of Health for over 10 years and has served as the Director of Public Health since October of 2020. Thank you for joining us this afternoon. At this time, I'd like to turn it over to Eduardo Cisneros and Luke McGowan from the White House.
Excellent. Thank you so much, Stephen. It's a pleasure to be with you. Good afternoon, everyone. Thank you for having me. I have some slides, but it's really short slides, so I'll just jump right in. We've been on the job for 30 days now, 33 days to be exact, but over a month. We're making some good progress on the COVID front. I specifically am on the COVID response team, which was established by the president via executive order on day 1. Our approach is to launch a whole of government comprehensive response to the pandemic. Central to our strategy is, of course, partnering with state and local leaders. And so we continue to thank you for your leadership on the ground at the county level and beyond, in neighborhoods, in your state as a key partner in this work. When we took office, we inherited some challenges. We didn't have enough supply, and we didn't have enough vaccinators to get shots in the arms, and not enough places to vaccinate people. And so once again, I think we've made some good progress. 33 days later, we still have a long road ahead of us, but we're executing strategy on multiple fronts, and that execution is yielding good results. In just 4 weeks, we've been able to increase our vaccine supply by over 50%. We went from 8.6 million doses a week on day 1, January 20th, to this week we're above 13.5 million doses per week, equally split approximately, half Moderna, half Pfizer. And so we'll continue to hopefully make good progress on vaccine supply. That is certainly top of mind and top priority for us. We're also optimistic. We expect the FDA to make a determination by the end of this week, hopefully, fingers crossed, an issue on the application for the EUA on Johnson & Johnson, the single dose vaccine. And so we'll certainly continue to keep this group posted on those efforts. We see county leaders as a key ally in this work as well. Jeanette, if you're able to turn to the next slide, it just kind of outlines what the way that we're thinking about this is. Certainly people, places, and supply. Once again, when we came in, we didn't have a full sense of our, what in terms of the staffing needed. We heard a lot of you guys have been in this fight for over a year. Counties have been leading the way on testing and COVID response. We're hearing a lot of our staff on the ground and public health departments and National Guard and nurses and medical staff and FQHC staff as well. I certainly know that are showing fatigue. They're tired, and so I think it's been a long road, but that is where our whole of government approach seeks to come in and help. And so in terms of people, we will bring all the resources of the federal government with FEMA and the Defense Department to the extent we can help. We're working hand in hand with state and local governments to make sure that we provide staffing support as well as places to get vaccinated as well. So in terms of the places, we've been partnering and we're very grateful for New York as we start to set up these FEMA supported mass vaccination sites of all sizes, not just the big stadiums with the Yankee Stadium type vaccination centers, but also those smaller, middle, and even smaller sized vaccination centers. And so we're grateful for your partnership on that. We know it's a collaboration effort with many partners to make those successful. Those in New York actually are just getting off the ground, at least the FEMA supported federal sites, the 4 that were recently announced. And so we look forward to hearing how those are going. Please keep us posted. We want to make sure that we lend support and that everyone is successful. As counties are successful, the entire country and the nation will be successful in fighting this pandemic. Other places that we're focusing on, as you guys might be tracking, and Stephen, thank you for pointing out the FQHC piece. Certainly, no one on this call is strangers to community health centers and FQHCs. We are just last week, this last week, we announced a formal partnership with FQHCs at the federal level to come in and allocate vaccines directly to health centers as well. In addition to allocations going to the state, we're also looking to FQHCs as key partners. In addition to FQHCs, we've also partnered with retail pharmacies as well. So Walgreens and CVS had helped us with the long-term care program. And so now we've actually focused on the retail program as well. So partnering with 21 of the larger pharmacy chains to help us also get shots in arms. They certainly know how to do it. They've had flu seasons year in, year out, and we're seeing good progress. In just the 1 week, in just a week since they've been allocated vaccines, they've been able to get shots in arms, their entire allocation out the door and in arms. And so we're really grateful for retail partners as well. And then lastly, in terms of supply, I kind of touched on it at the top, but know that this is certainly top of mind and a key priority for us. The president is prepared and actually already has instituted under his authority the Defense Production Act to accelerate vaccination or vaccine supply, and not just vaccine supply, but also thinking about testing as a key strategy in our efforts, PPE, making sure that we're building domestically and accelerating that production, thinking about how do we support schools safely opening. We've announced some additional resources for testing. We're calling on Congress to double down on federal resources for states and local governments to support this important work. And so we will continue to focus laser-like on increasing supply. And we anticipate as we get more supply, it'll be a little bit harder to reach folks given vaccine hesitancy and also just access. And so we've also launched a national equity task force led by my colleague, Dr. Marcela Nunez-Smith, who comes to us from Yale. And she's stood that up, and we have some good New Yorkers on that task force. So thank you for that. We look forward to their advice and guidance as we recover from this pandemic in an equitable way, and as we continue to like I said, focus on the most medically underserved and those falling between the cracks in this pandemic. And so certainly your leadership, your reach, from your purview, you'll be tremendously helpful in making sure that as we get more supply and vaccines out the door, that we reach those populations that are harder to reach and a little bit more reluctant on the vaccine. And so, again, we see you and everyone on this call as a key partner in this work. And so we're here to help. We're here to be of service. Please let us know how we can continue to support. We stand by. Once again, ready to use the full weight of the federal government as best we can to support the efforts. We're really privileged to be invited to speak to you. I'm happy to stick around to take questions. I think once again, 30 days on the job and are making good progress, but we have a long road ahead of us, and we look forward to counting on you as key partners in this critical work. And with that, I'll stop and I'll hand it back over to you, Stephen. Or actually, why don't I?
Yeah, let's do this, Mr. Cisneros, Eduardo. Before we go to Mr. McGowan, can you just tell our audience about, we have a quick question here, I thought I put it in here now. What is a federally qualified health center, an FQHC? Can you put that into some context here and how they're engaged with the federal government with the vaccine?
Yes, no, thank you. So FQHCs, and I worked at one in Allegheny County most recently before joining the White House team. FQHCs were established, several decades ago by the federal government and intentionally designed and located as community clinics providing comprehensive health care, but also been key allies in this work around the pandemic. They're by design located in the most medically underserved areas, and so the federal government comes in and establishes the federally qualified health centers, also known as community health centers, in those most medically vulnerable and underserved areas. And so that was a strategy seen as the leaders, at a national level to support reaching and providing healthcare to those most underserved. FQHCs have been already key allies in this work. Again, they provide key healthcare day in, day out. And then on the testing front, many of them were partners in this work. As of last week, the partnership we announced in allocating them 2 million doses weekly is a new initiative for us to double down on that infrastructure of health centers across the country. And that is a system that it's led by HHS and HRSA and the CDC over there. They identify, they look at certain criteria, and that's how the FQHCs are selected. Very importantly, we want to make sure that the FQHCs have the capacity to get shots in arms and even to store and refrigerate, for instance, the Pfizer vaccine. So key allies in our work, health centers and FQHCs, but look to, as again, once we get more vaccine supply or vaccines, we'll make sure to increase that that allocation to the FQHCs, but we'll certainly are phasing it in and looking to make sure that we're monitoring performance as we scale that program up as well. So just another avenue to get more shots in the arms, especially those most medically underserved pockets of our communities.
Terrific, Eduardo. Thank you so much for that explanation. Mr. McGowan.
Hi, Stephen. Can you hear me okay?
Yes, we can. Thank you.
All right. Well, thank you, Stephen, for having me on and for that introduction. And thank you to the audience here. As folks heard, right before I joined the White House, just a few weeks ago, I was living in Burlington, Vermont. So I spent time, actually that picture, I was looking out the window towards Clinton County, across the lake. So whoever my counterpart over there was, hello to you. I am here today really to just give a quick update on the American Rescue Plan, which I know folks are likely following quite closely. I was working in local government for the last couple of years, and especially this last year, I know how exhausted all of you must be, how critical all of you are to the response, and that all of you are partners to the federal government as we implement all of our strategies to address the virus and build back better. So just to kind of lay the groundwork and what's motivating us, I mean, Eduardo did a great job touching on kind of everything that's going on with the virus. I don't need to tell people the milestones we are crossing. I mean, really this week, 500,000 Americans who have died of COVID, 20 million have contracted the virus. The economic pain that you all are seeing, 1 in 5 renters are behind on rent, 1 in 10 homeowners have missed a mortgage payment, 10 million Americans are unemployed today, and 1 in 7 Americans are struggling even to put food on the table. That is what is motivating the American Rescue Plan. That's why the president has made this his priority, and it's a priority out in the country. There's strong bipartisan support for this relief plan. 7 in 10 Americans support the plan. Almost 70% of independents and a majority of Republicans support the plan. So when you go into localities, especially when you talk to state, local, and county leaders around the country, they recognize the need for this relief plan. And something that we've heard loud and clear from all of you, and what's built into the proposal, is this notion of direct and flexible aid. All of you are at the front lines of the response, both to the health crisis, but also to the economic crisis. And so we want to make sure that you have the resources you need to address those crises. And where this is today, and the status, I think probably all of you, or at least the association, is probably sharing information about the status on the Hill. We are optimistic that this relief package is going to pass really in the next couple weeks, see final passage. Congress has set a deadline of March 14th, which is when unemployment benefits expire. And so we anticipate seeing this plan see final passage and then very quickly move to implementation really in the weeks ahead. So just 2 things I wanted to touch on quickly. The rescue plan itself is really the relief package. That's what we'll see first. Second is a major infrastructure plan. So all of you should be thinking about this already in terms of that second piece. All of you should already be thinking about, are there infrastructure investments in your communities that would be ready to go, that are already lined up? If there are policy changes or critical path changes that need to happen, you should start having those conversations now, both at the state level, but directly with federal agencies. If you think in order to get something through, it's going to require a conversation at Department of Transportation or so on, there's nothing stopping all of you from having those conversations, and I'm happy to help facilitate that. But really, where I really want to focus is on the rescue plan, which we're about to see passage of. We're optimistic about passage of. It's really divided into 3 parts. First is knocking down the virus, and that's mounting a national vaccination program, containing COVID, and safely reopening schools. And Eduardo has already touched on a number of these items, so I won't go through it, but critical to anything, so critical to the economic recovery, is that we get this virus under control. And so that is where you are going to see increased resources coming out of the American Rescue Plan straight to localities, including counties, to make sure you have those resources to get all of that work done. The second big part of the American Rescue Plan is immediate relief to the working families that are bearing the brunt of this crisis. So that's the news that you've seen about the $1,400 per person checks to households across America. That's direct housing and nutrition assistance. That's expanding access to safe and reliable childcare and expanding affordable health care. That is a provision to increase the minimum wage. That's an extension of unemployment insurance. And that's also new family assistance measures, emergency boosts for this year to families with children. Finally, the third bucket is this new support to communities that are struggling in the wake of COVID. And so when we're talking about communities, we're talking about really 2 things. One, it's the small businesses that are the cornerstone of any healthy community that have truly suffered in this crisis and are going to need new support to get back on their feet. So there's a new grant and loan program being built into the American Rescue Plan that goes further than previous plans, especially in areas of equity, to make sure that both smaller businesses, but also those owned and managed by people of color are able to access the financial resources that they often lose out on when these bigger programs come to bear. So that's number one. But number two, and I think is of a special interest to this group, is new support to protect the jobs of the first responders, transit workers, and other essential workers that we all depend on. And those are the folks in government, in county governments around the country and in New York. So this is additional resources really at the county level. And I think we've split, and don't quote me on this number, but we're essentially looking at 60% of benefits of this direct financial support going to the state, 40% going to municipalities and localities, including counties. And so that's built in, and that's going to be coming soon, assuming final passage of the bill. I'll just close in saying we welcome your input. So my job is to make sure that all of you have a voice in this process. Having worked with some of these federal programs over the last year, I know the frustration of, even when you get grant money, sometimes if the guidance is shifting or non-existent, that can be a tough road to hoe. And so I want to make sure if you see something that you have the ability to say something about, hey, this program that's either being run out of this department or that department, it needs more, it needs this tweak, it needs this change. I want you to know that I can be a resource for you there. So I will stop. I've talked for a while. I'm happy to take questions, but also if you can share my email address, Stephen, so folks have it, and happy to route any questions about the rescue plan. So that's all I got.
Okay, terrific. Thank you very much, Luke McGowan, Senior Advisor in the White House, Eduardo Cisneros. They will stay on the call here for a little while longer and take questions as we get through these next presentations. Let's go to Dr. Larry Eisenstein, the board certified in infectious disease Commissioner of Health in the great county of Nassau and its population of 1.35 million residents. Dr. Eisenstein also serves as the president of the New York State Association of County Health Officials, a very important governmental partner right now, right here in the state of New York, battling this pandemic, and its great executive director, Sarah Ravenhall. Let's go to Dr. Eisenstein. Doctor.
Thanks, Steve. And I'm no longer the president of NICEHO, so that might be slightly outdated, but I am on the...
That's when I met you, though.
And I apologize to everybody that that's the picture you have to look at while I'm speaking for the next however many minutes. So I'll try and make it quick. And Steve, you had me follow up people from the White House. I've presented a lot of times at NISAC, but this is a tough act to follow. But thanks for the information and thanks for inviting me. And, I was just thinking a little over 8 years ago, I walked out of a small gym at Nassau Community College where we had stood up a special needs shelter following Superstorm Sandy, which really hit Long Island hard. And we had hundreds of residents who had medical needs, not sick enough to be in a hospital, but needed assistance. And with the help of our Medical Reserve Corps and our Public Health Emergency Preparedness Team, they stayed with us at this shelter. And I remember leaving that shelter when it finally closed, and it went so well, some people were happier there than at home. And it was tough to get people to leave. And I just remember thinking the response to Sandy will probably be, one of the key moments of my career, and hopefully I'll never be back in this space again. Well, right now, my vaccination team is in that exact space. And today, our non-clinical health department, and I am the only physician at the Nassau County Department of Health, my emergency preparedness team is 3 full-time people, but we have over 1,000 Medical Reserve Corps members who we do drills and we train. As of today, we will pass 30,000 vaccinations done by our Medical Reserve Corps vaccinators and our entire Department of Health. We train and we prepare for this. Now, 30,000 is not a lot in the scope of a county of 1.35 million. We have 11 hospitals, including the Northwell system, and certainly they've vaccinated more than we have. But on day one, we got it up and running, and it adds up, and it's vital work, and it's all hands on deck. We have engineers who are running the vaccine to the stations. We have, you name the job description, they have been retrofitted for vaccinating at our pods and getting as many doses into people as quickly as possible. We have a greater than 100% rate of getting vaccine in arms because we learned early that depending on the needles you use, you could get we had just Moderna, not the Pfizer, we were getting 11 doses instead of 10 out of the vials, which, by the way, presents a challenge, and I'll talk about the challenges later. The challenge being, when you get the second dose, you're not getting 11 doses, you're only getting 10. And if you run out of the short needles, you might fall short on second doses. So sometimes your best efforts, and I hope the gentleman from the White House heard that, because the needle supply and the syringe supply and factors like that really do relate to how quickly and efficiently you can get your population vaccinated. I bring up the story about coming from that same building during Hurricane Sandy. It's not that we love that building, it's that we drill in that building. We know that building, and many of my county legislators have called and said, why don't you do the pod here in my community? And the fact is, we have a few places that we do our drills. There's so much that goes into it. It's very hard to just go to a new location. You have to make sure there's a secure room that can serve as a pharmacy, because obviously the vaccine needs to be guarded and protected and is very valuable. You need to address public transportation. You need to address parking. You need to address power and make sure there's backup power, especially if you have vaccine that requires freezing. You have to make sure that if you're doing observation like we do after vaccination, that there's adequate space aside from the vaccinating space. You need to assure that there's a flow where people coming in aren't crossing with people going out. There's so many factors, and I bring it up because local health departments in New York, with the help of the state health department, have drilled and prepared for these moments. And as an infectious disease doctor, people ask me, are you stunned by this? Are you surprised by this? No infectious disease doctor would tell you they did not think a pandemic could happen. In fact, history tells us it has, and it does happen, and it likely at some point, unfortunately, will happen again. It's part of the fascination many of us in infectious disease feel as doctors, that we know the infectious disease world is constantly evolving, and the job as an infectious disease and public health practitioner is not the same. The issues are not the same as they were when I started at the health department in 2009. That's part of what makes it interesting and exciting and unfortunately deadly. And so when I turn back, we've had a great experience with the 11 hospitals in Nassau County. We have great partnership. We have been able to make sure that everybody has been able to use their allotment. And if somebody was running out of a supply, we've worked as a network together. But there are challenges. And the first challenge really is a simple matter of supply and demand. It's not a surprise. But yet, part of this presentation is about communication. It does seem that the public doesn't quite understand, in the sense that New York State gets 300,000 doses a week, as the governor's been talking about. My county has close to probably 800,000 or 900,000 of people eligible. We've been getting 2,800 doses to the health department. So you're talking about supply and demand on an epic scale. And there was a night a few weeks back where we opened up 2,500 slots for teachers, because as you know, or maybe the legislators don't know, your local health departments have been designated to vaccinate the essential workers in Group 1B, law enforcement, fire, grocery store workers, teachers, college professors, and others. Well, we put up 2,500 teacher spots on a public link, 2,500, and they were gone in under 10 minutes. That's the situation we're dealing with. And unfortunately, even though you put, and this is one of the great challenges, even though you put on the link, this is a teacher's pod only. If you are not a teacher and do not have ID, we will not admit you. Many of them, anybody who saw the link, posted, signed up. And we had to turn away a lot of people. Many teachers came with their parents or their grandparents. And it's simply a matter of, this is what we were assigned and we have to carry out the duty. But in the very beginning, I think we needed to understand, even the first week, Pfizer came first. Moderna was not even available the first week. We have to allow for a ramp up. As Mr. Cisneros said, you're starting to see numbers dramatically increase and improve. And so while there's a lot of talk about hesitancy, I'm working very hard to try and make sure that there are hundreds of thousands of people in my county not hesitant, desperate to become vaccinated. We're trying to keep order. We're trying to, if you put a waiting list out that anybody can sign up on, then you could have a couple of 100,000 people on a waiting list. And when they're on the list, there's a false belief that that means that they're up soon. And so we've tried to be transparent and fair. And when we have vaccine available, make sure that we're reaching all of our designated populations that we're supposed to be vaccinating. We've done so with a very keen eye on equity. We understand the health disparities, and Nassau County typically has very good overall health outcomes, but we acknowledge that those health outcomes are not shared in every community. As such, now that we're reaching a point, where we can share vaccine with certain select partners, we talked about federally qualified health centers. That's who's going to be one of our first partners that we share vaccine with. They'll be getting a redistribution to make sure they're reaching people with underlying health conditions, which they can do through their electronic health record in underserved, vulnerable populations. We have to make sure there's an effort at that. With the help of Northwell Health System, one of our hubs, multiple churches and other organizations in underserved communities have had smaller pop-up sites, and that's also part of it. But the main health department sites have been 2 sites. My whole health department has a little bit under 200 people, and that covers, we still are doing disease investigation, and we are still doing all of the work that your local health department has to do besides communicable disease control. We have to make sure that the water is safe to drink and the food is safe to eat, and that children with special needs are getting the services they need. And so it's all hands on deck. I'm so proud of how many people have just taken on responsibilities. And I will say, getting in there and vaccinating myself, don't mean vaccinating myself, but being a vaccinator myself has been really rewarding. And I put on a white coat and got a new white coat embroidered. And it's the first time I put it on in a little bit over a decade. It has been incredibly rewarding work. Public health, very often the measures that you take impact the population as a whole, and you realize that you're making a dramatic difference. But in this case, you actually see the people face to face. And on a day when we have a lot of immune compromised people, or back when we were vaccinating seniors, at the end of the day, if your team has vaccinated 700 or 800 or 1,000 people that day, that somebody is going to live because you vaccinated them. And it's been very rewarding work. I'm so proud of the health department having done really well with that. The challenges of supply and demand hopefully will ease. The challenges of people signing up on links they don't belong. We're trying to not be punitive. We're trying to explain the rationale and make sure it's equitable. The challenges of different size needles, and this is something, we're working through procurement and purchasing. We were getting 11 doses pretty much on everybody, which meant we could vaccinate more people. And that was the goal, to vaccinate as many people as quickly as possible. But you do have to remember downstream, in the case of Moderna, 4 weeks later, or in the case of Pfizer, 3 weeks later, you're going to have to do a second vaccine. And so we might need to bring up through NISAC up to our friends at the White House the fact that if we've been able to get 11 doses, we need the same equipment to be able to get 11 doses for the second round of vaccine. And I just wanted to put that on the radar. I do want to talk very briefly about the messaging. We saw a slide before that talked about how the media is a big part of how people get their messaging. And one of the things that I think we're missing is when we talk about the effectiveness of vaccines. And I actually had somebody who I was a vaccinator last week at a pod, and he sat down and he said, "Which vaccine am I getting?" And I said, "We have Moderna today." He said, No, I want Pfizer." And I said, "Well, why do you want Pfizer? They're very similar vaccines, and we only have Moderna, so even if you don't want it, that's the only one we have." He ended up leaving, and his logic was that Pfizer's 95% effective and Moderna's 94.5% effective, and he wants the better one, quote unquote. I tried in every way to explain why it's so important to get the vaccine, and that those numbers, I think people don't understand what they mean. And I think this is such an important thing that we go over, because Johnson & Johnson, 1 dose logistically is so helpful, so important. And I could tell you the second dosing is logistically very difficult. We're getting it done, but think about if we didn't have to do second doses, we literally would have double the number of people vaccinated in a very short amount of time. In the clinical trials, Johnson & Johnson wasn't 94% or 95% effective at preventing disease. It was somewhere in the 70s. But here's the point that you don't hear enough. It was completely effective against hospitalization and death. These vaccines essentially, and I'll never say 100% in anything with medicine, but pretty close, these vaccines prevent you from dying. That's the goal here. That should be the message. When this guy said to me 94.5 versus 95%, I can't argue that a clinical trial showed there was a 0.5% chance of contracting disease, although nobody even defines that. What does it mean? That we could grow virus if we swab your nose, that you get sick, that you get minor symptoms, or what? People very often, when they hear these numbers, the context doesn't come with it. And so I think it's so important to message. You want to know why to be vaccinated? Because the vaccine will prevent you from dying. We can't say 100%, but really, really close to that. And the Johnson & Johnson vaccine, which is the early indication was that it's in the 70th percentile of around there of preventing illness, was in the studies 100% preventive against death. And here's the thing, they did part of that trial in South Africa. In South Africa, where with the South African variant, the Johnson & Johnson vaccine dropped. And the headline was, Johnson & Johnson vaccine doesn't work as well with the South African variant. As a headline, that's factually true because it only prevented illness in 57% of people as compared to 72% without the variant. But even in South Africa, it was 100% preventive against death. That's the message that we need to give out. You want to get rid of hesitancy? My feeling, and this is just my opinion, two things. Give people who are hesitant an incentive or reason that the vaccination, I love what the CDC did, and the White House people should know. From an infectious disease standpoint, and I just wrote an editorial in a local paper about this, everything we do in medicine, we balance the risks and the benefits. We're not going to get to a point where there's zero risk of COVID in society unless we totally eradicate it, and we're not able to vaccinate kids yet. That point is nowhere near us. But people who are vaccinated, we should be honest. Once they're fully vaccinated, the risk is not zero. They could still contract disease. I guess very rarely they could have very severe hospitalization or death. But the fact is, we know that the risk to people after they're fully vaccinated drops dramatically. And so the benefits of quarantining people is limited in that scenario. Then you really have to look at, should we be quarantining people who are vaccinated? I don't think we should, unless there's a certain an added circumstance, such as a dangerous variant where the common data doesn't apply. But keeping people quarantined and home from work and isolated from friends and family, and the economic costs we heard about before, the psychological costs, the mental health impacts. Children, I have teenagers, I feel so terribly for what they're going through. And the kids who graduated high school last year and the start of their college career this year, my heart breaks for them. But vaccination is a way, in my opinion, to alter the risk-benefit ratio. I'll always wear a mask when I fly for the rest of my life, because if I'm flying, I don't want to catch any virus and ruin my vacation. But now that I'm vaccinated, I don't feel the sense of danger. And as an infectious disease doctor, and many of us are germaphobes, I didn't want to leave my house other than to work at all. Now I'm going to go to the supermarket. I'm going to stay away from people. I'm still going to wear my mask, but I'm not going to, realistically, the risk-benefit ratio changes. The benefit is for me to contribute to the economy in my community. The benefit is for me to go out and do shopping and make sure that, you know, my family has everything we need rather than lock ourselves up. And so just from a messaging position, I genuinely believe we need to just remind people that not to focus necessarily on the numbers that you hear of how effective the vaccine is, but what does that mean to the average person? To the average person, it means if they're fully vaccinated, it's very, very unlikely that they would die. And that's what we all want. I think we could all live with a couple of sniffles in the worst case scenario, but we don't want to die and we don't want to spread disease to our loved ones. We don't yet know how much disease can be transmitted in people who are fully vaccinated. Historically, I think there's got to be a protective effect. Maybe not 100%, and I can't quantify it, so I acknowledge that we don't know yet. But once those studies come out, we have to really consider policy based on the risk-benefit that we do with all medical decision making. And for right now, when people come to the pod and are hesitant or they don't know why, when you tell them you get fully vaccinated, it's almost 100%. You can't say it's 100%, it's not, but you say it's almost 100% that you are going to not die of COVID, to me, that's so much more compelling than if you say, well, there's a 94.5% that you won't contract disease. And if Johnson & Johnson at 72%, these vaccines are incredible. They are lifesavers. We should celebrate that. We should emphasize that. And we should take becoming vaccine something that should become fashionable. It should become, especially with the younger crowds. And we know, and all the studies show, and we've been saying this, and we saw it over, you know, the fall, it's young socializing people in the 20s through the 40s who are the majority of transmitters of disease. Give them a reason to make sure they're vaccinated. And I really do see a bright future ahead. So we have challenges. Your local health departments train for this. We're prepared for this. We know how to do this. And I think in every health department in the state, I see photos on NICEHO's website. They're doing great. The pods are going great. People are satisfied with local government. The ones lucky enough to get an appointment anyway. And we know there's frustration, but simply it's a matter of supply and demand. And every day that the supply grows and we can get it into arms, you know, it's really fantastic. And health departments are flexible. We know we had weather issues. So I just got a dose. We didn't have doses over the weekend. We had used them all up very quickly, what we had. Well, we got first doses in this morning, and we have full pods at multiple sites scheduled tomorrow already. One of the lessons we've learned, and we from day one, we followed this. We never made appointments before we were holding vaccine, because until it's actually in your hand, you don't know, is there an issue? And so the demand is so high right now that we have full pods scheduled tomorrow and haven't even put out the links for appointments yet. We know it will fill up in a matter of minutes. And so the answer is, we got vaccine today. We're having second dose pods this afternoon, and we're going to have full first dose pods at all of our sites tomorrow morning, first thing. And nobody's even registered yet. We are going to have full crowd without any issue whatsoever within the groups that's been, you know, delegated to us. So just my quick update on a few of the challenges, a few of the successes, and just my own opinion. And I want to be clear that these are my opinions on the messaging and interpretation of the statistics, but that's just kind of my view on this, and I'm sick of looking at myself on the screen. So I'll turn it back to you, Steve.
Thank you, Dr. Eisenstein, and thank you for your passionate presentation and your medically informed opinion. Very appreciative of that. Thank you so much for giving us your time and attention today. Tyler Shaw from Allegheny County, switching hundreds of miles to Western New York in Allegheny County. Let's hear from you. You've been in the Department of Health in Allegheny County for over 10 years and joined the county as its director in October 2020. Your thoughts on the vaccine distribution from a rural perspective? Okay, I'm not hearing any sound here from Mr. Shaw. While we're waiting to hear from Mr. Shaw, is Mr. McGowan still with us, and Mr. Cisneros?
Stephen, this is Eduardo. I'm still here.
Eduardo, while we're waiting for sound here, we're having some sound problems with Tyler Shaw's presentation here now. Children, can you speak about children and the vaccine under age 16? What's the plan? How are the trials coming along underway for children under 16?
You know, that's maybe one that I'll have to get back to you on and take back to my team. And certainly, you know, I'll let one of my MD colleagues speak a little bit more to it. My understanding is there are some, you know, studies underway. We don't have anything near ready to share yet. I think for the most part, we've been focusing on the kind of population at hand, understanding that, you know, youth and kids are less at risk in terms of the virus, and we saw that in some of the CDC's decisions around the schools, looking at opening up K through 8, for instance, understanding that it's less transmission at that level. But I'll certainly have to get back to you on the updates
Okay.
of where we're at and any future kind of, to the extent we can share kind of thinking on that, but happy to circle back on that piece. Great question.
Okay, thank you. Tyler, are you with us, or can I keep asking questions?
Can you hear me, Stephen?
Okay, I can. Thank you. Tyler, the floor is yours. Thanks for joining us from a rural perspective, Allegheny County. Go right ahead.
Thank you so much. Thanks, NISAC, for the invite. I do appreciate it. As Stephen alluded to, it started in the director position in October, right in the thick of the pandemic, and has been kind of driving the ship ever since. So here's kind of the outline of what I plan to talk to NISAC today. Thank you all for joining. We're going to go into some of our health stats just from the Allegheny County's perspective. We are a very small rural county in western New York. Some planning considerations that we use for vaccine distribution and communications. I'm sure many of you are familiar with the phase and priority groups in New York State for vaccination. Our community partners, we're going to go into a little bit of some of our pods and what that looks like, and our structure and framework, and then kind of what obstacles, hurdles, and then what's next. Next slide, please. So our COVID-19 stats doesn't seem like a lot. We got a population of about 46,000 in Allegheny County. Our total confirmed cases as of the 19th was 2,878, which again doesn't seem like a lot, but putting it into perspective, I have 30 full-time employees here at the health department in Allegheny County. Our first doses administered strictly by the county health department is only 855, and that equates to about a 7.5% vaccination rate in Allegheny County, which is the lowest in the state, which has garnered some attention lately. Some health outcomes, we are ranked 47 out of 62 counties, which health outcomes, as you may be familiar with, includes the quality of medical care, the availability of good jobs, affordable housing, that's just to name a few. And then on the flip side of that, the health factors, we're ranked 52 out of 62 in New York State. And health factors include things like health behaviors, clinical care, social and economic factors, physical environment factors. And then lastly, our 65 and over population. We do have a fairly large population here in Allegheny County. About 20% of our population is over the age of 65. Next slide, please. Some planning considerations. So looking at ICS structure, staffing levels, throughput, registrations, medical evaluations, vaccinations, and recovery. So like Dr. Eisenstein had alluded to, there's a lot of planning that goes into these pods, a lot of considerations, a lot of moving parts, a lot of logistics, a lot of operations, a lot of ancillary things. Safety is paramount concern when you're giving vaccinations. So thinking about how do you do this safely? How do you move people through safely with all the different criteria and requirements for physical and social distancing? So we've looked at basically setting up some sort of framework or ICS structure where our employees know who to report to, the public kind of knows who to report to, and they see this kind of flow through our various pods. So we've considered what staffing levels are needed. I alluded to we had 30 full-time employees working in our various programs in the health department. I only have 3 full-time nursing staff available just through the health department, but we do, of course, have a robust volunteer corps, and we have a lot of community partners that are willing to step up and help us vaccinate. We've been utilizing all of our staff throughout the pandemic. We've been utilizing a small team of about 6 contact tracers to continue on that work as well during the COVID-19 pandemic. Third, how many people can you realistically vaccinate during your clinic? That's a question we've asked ourselves many times. How long does it take one person to get through the entire process from registration to recovery? Where are your bottlenecks? How do you deal with limitations of the registration system? When residents answer yes to various screening questions, we have to have a medical evaluation for whether the individual can receive the COVID-19 vaccine. We've partnered with our county jail medical staff to assist us in providing various services, including vaccination and medical evaluations. Providing vaccines, credentialing volunteers, going over safety protocols, infection control, disinfection, PPE, information management, managing extra doses, all of that comes into play when you're planning on distributing vaccine. Next slide, please. So I'm sure everyone's familiar with the phase and priority groups. 2 phases doesn't seem like much, but within those phases, there are plenty of categories. We estimate about now, with the underlying comorbidity conditions, we probably estimate about 25,000 individuals are eligible in phase 1B alone in Allegheny County. Typically, Allegheny County has received about 100 doses of vaccine per week since the beginning of January. For the 65 and older population, the pharmacies are required to vaccinate these individuals. We've only had one pharmacy that has been allocated in our county, and that's been about 100 doses per week. And that pharmacy is located on one of the outer edges of our county, making it difficult for our other county residents who may live 45 to 50 minutes away to get to that pharmacy. Not to mention the supply and demand issues are still applicable here in Allegheny County, even though we're rural. Typically, when our registration links go up, our appointments are filled in under 10 seconds. Next slide, please. So here are some of our community partners, and all of our community partners make it a little easier in distributing vaccine, from the EMS supporting our patient observation and vaccination to our hospitals assisting in vaccinating 1A individuals, as well as other community members. We continue to train our volunteers in anticipation for larger vaccination clinics, but for right now, we're holding our vaccination clinics only at the county health department because we're receiving such few doses from the state allocation. We've worked with our pharmacy who was overrun with phone calls asking about the COVID-19 vaccine. We've developed a centralized waiting list for our 65 and over population because these residents typically have either access issues to either the internet or capability issues due to computer usage. So we've worked with our Office for the Aging in helping us assist in calling these individuals and actually scheduling them for appointments. We're also, of course, realistic. In the waiting list comes an expectation that there will be a vaccine available. Right now, our waiting list for 65 and over population currently has over 2,700 individuals on it, and we're only getting 100 doses a week. So it makes it very difficult managing those expectations. We do have plans in place to utilize our colleges and universities or school districts for our mass vaccination sites, and we have had help from other county departments to continue our contact tracing. We've used Department of Social Services employees who have a special skill set in interviewing. We've also used some of our county treasurer staff in contact tracing as well. Next slide, please. So points of dispensing, or pods, as we refer to them. Pod plans are meant to be agile and adaptable to various settings and locations. We have plans for multiple different locations, venues across Allegheny County to include businesses, schools, fire halls, community congregate settings. Right now with our current allocation, as I've said before, we're strictly doing it in-house because we're able to get those allocations out in 1 day time. Our locations are able to be moved in order to reach various parts of the county. We have a large Amish and Mennonite community, and some are interested in vaccination at times. We have communities that do not have pharmacies or medical offices. We have communities that have higher rates of transportation issues. We have communities that are more densely populated than others. The flow for our vaccine clinics will be shown on the next slide. This is probably the aspect of vaccine distribution that we have found to be the most important, aside from registration. The public counts on the health department and all local health departments to be efficient and effective at administering vaccines to a large amount of people. Next slide, please. So here's kind of our flow, just a basic framework. We've got pre-registration, greeting, registration, vaccination, recovery, and then you managing your second dose appointments at that time as well. Within all of these categories, there are subcategories, such as greeting includes an eligibility check that individuals fit into one of the current phases. There's also checking on the state vaccination attestation form. We do have issues in our county with, of course, internet access and computer access, so we do have paper forms available for our public participants for our clinics. We also, in that, includes collecting insurance cards for billing purposes, and the registration process includes checking individuals into CDMS, going over screening questions, and cross-training our employees to be able to function in any one of those areas, aside from our vaccinators, of course, which is our medically trained staff. Next slide, please. These are just some of the obstacles and hurdles that we've overcome so far in terms of vaccine distribution. We only have 3 nurses, as I've stated before, in our health department. That severely limits our amount of vaccine we are able to administer without our community partners and our volunteer corps. We've asked other county departments, as well as volunteers from school nurses to college health staff, to assist in our vaccination efforts. We've utilized EMTs to vaccinate and have partnered with our local hospital to assist in vaccination efforts. CDMS, or the Counter Data Management System, which is the primary registration system for the state, has its own struggles, from individuals showing up with proof of registration and them not showing up in the system, to needing and adding individuals to expand the times in the CDMS registration link, which I'm sure most of the local health departments can attest to. People are monitoring those registration links like hawks. We opened up a slot on a Friday afternoon to just add some people that were not showing up in the system, and we already had 15 appointments in under 5 seconds when we opened that link. We've had fairly large 65+ population, as I stated before. We've decided to keep a waiting list for those individuals only because of that lack of access to the internet and computer capabilities. As of right now, our 64 and under are basically vying for our registration link that is posted on our webpage. Because our county is small and rural, we have developed an email group where we send out information about the registration link when it will be published. So that registration email includes our school districts, our businesses, and we've identified in those priority groups that would be beneficial for them in getting the COVID-19 vaccine. To date, I did talk about our vaccine appointments filling up in 10 seconds. Initially, we were getting additional first doses, as Dr. Eisenstein had alluded to as well, and that presented an issue with us for the second doses because we were not being allocated the same amount as the first doses. So we did manage that. It's been proven to be a balancing act. We try to stay around the first dose allocation mark because we don't want to subject a second dose person or not having that vaccine available. Adverse reactions have been very few, but we've had some. We recognize if any individual is having a reaction or needs attention, we have a private space for them so that they are comfortable and not on display in front of others. Equity, this has been a hard one. We have a member on our health equity task force, as I'm sure each and every county does. The group continues to work on making equitable decisions for individuals based on race, ethnicity, zip codes with lower health outcomes, communities with no pharmacies, communities that lack internet access, etc. The portion of this equity when you have a small it's more difficult when you have smaller quantities of vaccine to make it a little bit easier for the equity issue. So it's been hard when you have 100 doses and it goes in under 5 seconds. There's such a large population that's eligible for the vaccine. There's this entitlement mentality that because they're in the eligible priority groups that they're entitled to be vaccinated, and we just don't have the amount of vaccine to supply them with. Next slide, please. So what's next? So of course, advocating for additional vaccine in Allegheny County has been a hot topic in the past week. It is clear that Allegheny County has not received its fair share of vaccine. The state is utilizing population as a metric. The mark is missed with our allocations. Allegheny County lags behind every other county, and not because we have not asked for vaccine or have not been able to administer it in a timely manner. Our socioeconomic factors, as well as our residents' lack of an ability to access health care, makes the county health department one of only a few vaccine providers within our borders. Our community members really look to the county health department for mass vaccination efforts. We will continue to train our volunteer corps in mass vaccination clinics and bring additional vaccinators on board to prepare for additional vaccine coming into Allegheny County. We'll continue to work with our various community partners to help in distribution of vaccine across our population. Once vaccine is more plentiful, we need to adjust our pod sites and use larger venues. And we've started to look at current race ethnicity data and how it compares to our overall county statistics. We are strategizing new ways to reach various populations. At the start of the pandemic, we utilized the Amish and Mennonite bishops to distribute information about COVID-19, and it's worked fairly well. We plan to use a similar strategy for vaccine if particular groups are interested in vaccination. We are looking at zip codes and how we distribute information and target specific areas in the county. That includes our data mining. And in closing, we continue to work with our state partners and community partners and promote the safety and efficacy of the COVID-19 vaccines based on the CDC's guidelines. Thank you. That's all for me.
Terrific, Tyler. If any folks have further questions, thanks so much. From a rural perspective, very important in New York. Many counties, just like many counties in the United States, are very rural, similar things happening across the country. And thank you again to Dr. Eisenstein for giving an urban perspective of the state's, one of the state's largest counties, Nassau County. A question for Eduardo, perhaps. Again, maybe you're not the person, but again, a perspective what you might be hearing on the variant strain that you're hearing being discovered across the United States. Some are saying this could be the predominant COVID-19 virus, the variant strain. What is the relationship between the existing vaccines and the variant strains that we're seeing coming in from the United Kingdom and South Africa?
Yeah, thank you, Stephen. You're right in that I would defer to once again my medical colleagues to more properly answer that, and probably Dr. Walensky over at the CDC. But what I will say is, from my purview on the intergovernmental affairs side, we certainly are treating it very, very serious as well. So right, so just still encouraging safety measures to remain vigilant when these emerge. We do have a CDC structure in place, and obviously work with the local and state governments in terms of just contact tracing and responding to that. But overall, I would say just continuing to be very, very just vigilant on those, and we are certainly tracking them and taking them very serious. So anything with regards to kind of the vaccine as it relates to the new variants, I wouldn't be able to kind of, I'm reluctant to touch on that, but know that from our purview, we are certainly treating that as serious as very seriously when those emerge, and we have been in states immediately within hours of them emerging. So if I can be of any resource on that front, please circulate my information, and I'm happy to help.
Okay, terrific. Another question coming in here on thoughts about immigrant access to the vaccines. Any thoughts on that?
I mean, I presume this question came up once, and I had an interesting case where kind of folks traveling into the country, I guess, to try to, that I probably would defer to the very thoughtful, county folks that were. At the end of the day, it's more of a local case by case how they would treat that. I don't know that we have at the federal level any guidance on that. Certainly, it'd be up to the jurisdictions as folks arrive, and then they're eligible, just given information they're provided. I'll hold back from kind of offering any thoughts on that one.
Okay. Another question here about federally qualified health centers and the amount of doses of the vaccines that are being allocated to the various FQHCs. Do you plan on sharing this information with the counties directly versus just going to the state, where we're relying on them to share with us? Is there any way that the counties around the United States can get a better understanding of the vaccine distributions that are going directly to the FQHCs?
Yes, and the program is certainly the response to that is yes. We want to make sure that that information is cascading down to the local governments as well, certainly the counties. It's a relatively new program, as I mentioned. It's a week old technically, but the HRSA team at HHS has established a website where they're going to be posting the latest and greatest on there, and so I can circulate that as well. It's on the HHS HRSA website, and they'll be offering the latest in terms of just allocations. As I mentioned, it's an initial, we're phasing in the program, starting with 1 million to 2 million actually weekly allocation, and we'll stay at that level for a little bit and see, just monitor performance, but certainly all that information will be available on the website.
Okay, we've reached our allocation of time here. I'm grateful for everybody spending their time with us this afternoon from the White House. Very pleased and very thoughtful presentation. Thank you very much for joining us today. We'll have this posted on our website later in the day, and I appreciate everyone's attention here. I want to thank our speakers and all of the county officials for joining us here today. Thank you so much. This will conclude today's webinar. Thank you.